Welcome everyone to another insightful episode from the Aig-Imoukhuede Foundation. My name is Aig-Imoukhuede and I am Executive Vice Chair at the Foundation. I am pleased to be hosting this critical discussion. Today, we are diving into a crucial element for strong and effective healthcare, especially at the grassroots level: community participation in primary healthcare centers or PHCs. When the people are involved, healthcare truly serves their needs. We will be exploring why this participation is so vital, how it shapes better health systems and outcomes, the strategies that have proven successful here in Nigeria, and how we can overcome the hurdles we often face. Joining me today are two distinguished guests, both bringing invaluable experience from the front lines of healthcare. Dr. Biobele Davidson and Dr. Oluwaseun Oladeinde. Dr. Biobele Davidson is a medical doctor and a public health advocate with a track record in strengthening healthcare systems across the country. She currently serves as the lead and administrative head of BudgIT in the Abuja office, where she leverages data and technology to enhance healthcare delivery. Through her experience serving as a medical consultant at the International Organization for Migration and Save the Children International, Dr. Davidson has led efforts in strengthening health systems, referral system strengthening, mental health care for children and adolescents, and disaster risk reduction programs. She is passionate about impactful evidence-based interventions and brings a multidisciplinary approach to improving access to quality healthcare. Welcome, Dr. Davidson.
Thank you very much. I'm glad to be here.
Dr. Oluwaseun Oladeinde is a medical doctor and a public health expert with a focus on primary healthcare and epidemiology. He currently serves as the Director of Planning, Research and Statistics in Lagos State Health District 5 and is the Medical Officer of Health of Amuwo, Odofin local government area of Lagos State. As a primary healthcare coordinator, he plays a critical role in strengthening primary healthcare systems. He's an alumnus of the third cohort of the AIG Public Leaders Program, during which he developed a reform project focused on enhancing healthcare access through community outreach programs and securing funding from the Basic Healthcare Provision Fund, a fund which aims to provide financial resources for primary healthcare services, particularly for indigent residents. Welcome, Dr. Oladeinde.
Thank you for having me. I'm happy to be here.
Okay, so let's get right into it. Some argue that primary healthcare centers are little more than glorified clinics and question why we invest in them when hospitals seem to be more impactful. While this sounds logical, it reveals a deep misunderstanding of the foundational role that primary healthcare centers play in our healthcare systems. So, Dr. Davidson, let's talk about the importance of primary healthcare centers. Why are they non-negotiable when it comes to building a resilient and effective healthcare system?
Thank you very much. So I usually start my question with who owns the primary healthcare system? And most times I get the response of people saying it's being owned by the community, it's been owned by the government, and some person says it's been owned by the community. Now, the primary healthcare system is the bedrock for any healthcare system because one, it is situated within the community itself. There's accessibility to these facilities. These facilities are manned by people who are known in the community. And then the community members also have to participate in the activities that go on in the community. Certain key things that we have looked at mostly is looking at curative care. How about preventive care? There's the healthcare centers in most of these communities provide health awareness. They provide health education. They're the first frontline persons who will attend to members of this community. They're the ones who are able to provide immediate care that is accessible to these people, that is affordable, and is within the geographical locations for the community itself. So for me, it's a non-negotiable thing because some of the poor health indicators that we begin to record as we see going up is because these healthcare facilities have been neglected and also have been underserved and then also have been underpowered. And most of them do not have the necessary equipment and even medications to be able to support the community. Thank you, and over from me.
Thank you very much, Dr. Davidson. And maybe I should just ask you, can you please help us to differentiate between primary healthcare centers, secondary healthcare centers, and tertiary healthcare centers, and what each is supposed to actually address?
Thank you very much. So I'm going to go down into a distinct definition that a lot of persons do not really understand about also the primary healthcare system. So the primary healthcare system itself functions on different tiers. So we have what we call the health post, we have what we call the primary healthcare clinic, and then we also have what we call the primary healthcare centers. So a distinct feature when sometimes some persons come to me, and I'll be very practical with this this conversation. Sometimes when people come to me and say, "Oh, I visited this facility and they don't offer these services, they just wasted my time," and then I ask them, "Where did you go?" And they say, "I went to the PHC itself." And I said, "Which of the PHCs did you go to?" Now, the health post, which was previously known as the dispensary, based on the National Primary Healthcare Minimum Service Package document, it's actually located in the village and then covers a radius of about 5,000 persons, or 500 persons rather. So you have those small settlements where people live, let's say a radius of about maybe 2 to 3 kilometers, and then you have 500 persons. So there's actually a health post, and the level of management for this facility is usually the village development committee and then also the community development centers. Now, if you move up the ladder, you now have the primary health clinics. And the primary healthcare clinics, they were previously called the maternity center or the basic healthcare centers. And these are also manned by the local government, the ward development committee. And for this particular subset, you have a group or a neighborhood of villages, and then they serve between 2,000 and 5,000 persons. And then when you move up again, you now have the primary healthcare centers, which were previously called the comprehensive health centers or the model PHCs. And these are manned by the local government as the highest level of engagement for them. And then you have one per ward. And then there are a total of 7,740 that is expected within the 10 wards. So you have one facility and an average of 10 wards. Now you come down to the general hospital, or you go up rather to the general hospital, and these are state-owned facilities that are managing them. You have so you have a minimum of 774 general hospitals in total, and then you now come down to the tertiary. So what differentiates these facilities is quite important to note that the differences range from one, the structure itself. So the structure that is being provided, the staff strength, so the human resource for health is also different across these facilities. The equipment that are also available to these facilities, the services they render, and then also who takes ownership of this facility. Now, for most of the work we do in the primary health care, we find out that the people who man these centers are usually ranging from, you have from maybe doctors in the PHC center, the primary healthcare center, and then you also have CHUs, you have junior CHUs. So this differentiation is in terms of the factors that I listed earlier, which I'll go over them again: the infrastructure, the staffing, the equipment, the services that are being provided, and also the ownership across this board. I hope I answered the question.
Yes, you did, very comprehensively. Thank you very much for that. So let me turn to you, Dr. Oladeinde. Why is it crucial that the community is carried along in the primary healthcare systems? Can you recall a moment from the field that really showed you the power of community participation and why this is uniquely important in PHCs?
Thank you for the question. I'm going to use this opportunity to present some of the findings I had with my capstone project under the foundation. My capstone project was strengthening public service, improving access to primary healthcare service, in a community in Lagos called Biobele community under Amuwo Odofin local government. So the project goal which we were able to achieve was to increase health-seeking behavior of the community, to increase immunization coverage for children under 5 years, and to reduce burden of physical and financial access to healthcare centers. So we noticed that carrying the community along was very, very crucial. To take ownership was crucial to ensure sustainability, and it was crucial to give ease of service delivery by the primary healthcare provider. So during the project, we had to train the community in the adoption of the Basic Healthcare Provision Fund, a fund that is earmarked by the federal government to cater for the poorest of the poor within the community. We had to train them to be knowledgeable about what the federal government has provided, and we have also had to train them on the modality of assessing the care and the need for the primary healthcare centers in their community to be taken care of, and then to also be on the same page with our primary healthcare provider in the health center. So this training gave an interaction between the primary healthcare provider and the community, where we were able to listen to their concern, and then we are able to also communicate the need for them to adopt and embrace looking at the burden of diseases in their community, why pregnant women need to come to the health center to reduce morbidity and mortality associated with pregnancy, why the children under 5 needed to be vaccinated, and why they need to support the primary healthcare provider to do outreaches within the community. So sustainability was key. We were able to achieve that, and we were also able to achieve the community trust, so that our healthcare provider at the community level had the support of the community in mobilizing them for outreach, and also when we go for outreach to ensure that mothers that we are looking for are mobilized to come. So engaging the community was very, very essential and was vital in achieving our aim of increasing the health-seeking behavior. We noticed that the general outpatient attendance of the primary health care center went up more than 50% compared to before we engaged them. We also noticed that routine immunization for children less than 5 years also increased for about 25% in the period of 1.5 quarters of the year during the intervention area. And we noticed that we were able to address common ailments that generally would not have presented at the primary healthcare center. They were mobilized to come, and then they benefited from the knowledge and skill of the primary healthcare provider. So in a nutshell, engaging the community is vital to gain the community trust, to increase our services in the community, and to prevent childhood killer diseases in the community. Thank you.
Amazing. Thank you very much for that very apt illustration. Basically, you're saying just having the primary healthcare center in the community is not enough. Basically, you have to go out, educate, engage the community to draw them to the primary healthcare centers to actually use the services. So you've both laid a strong foundation for this discussion. Now, let us explore specific models of community participation that have shown promise in Nigeria. Dr. Oladeinde's example is very prime data that we can actually use to scale community participation activities to drive the footsteps in the primary healthcare centers. But, at the foundation, we recently published a technical article emphasizing the importance that community participation plays in achieving improved healthcare outcomes. And in fact, we should have leveraged the example that Dr. Oladeinde gave because that data is very fascinating. But I want to specifically reference the COVID-19 Community Response and Health Education Initiative, which ran between 2020 and 2022. Now, this initiative clearly demonstrated what happens when community members and leaders are at the forefront of spreading vital information like safety protocols and contact tracing, while also distributing life-saving materials. So, Dr. Davidson, beyond pandemic responses, what other models of community participation have proven effective in improving primary healthcare outcomes in your experience?
Okay, thank you very much. So we currently had BudgIT Foundation. We currently had we had a program which was called Strengthening Community Engagement and Accountability. And what we were doing was looking at the community model itself. So we were looking at the bottom to top approach for interventions. And what we did with that was to link it up as a data organization with the PHC accountability portal, which is a portal that is created live for individuals to provide feedback. And you'll be amazed at how many persons. So we had piloted this across 5 states. It was a 2-year project that was running across 5 states. You will be amazed at how many individuals who came up to say, I need to provide a feedback about the state of my PHC. Now, this for us was a very interesting engagement because we're able to capture not just community members, but breaking them into different sectors or segments to ensure inclusivity. So we're able to capture women, we're able to capture men, we're able to capture people from the different age groups. And then we're also able to capture the young persons who were also not actively included in the system itself. We're able to capture the responses from the facility themselves. We're able to capture the responses from concerned citizens, from government structure. And for us, I sat down recently and I was reading through some of these feedbacks. And for the feedbacks that had been analyzed, we had 48,000 persons across 5 states in 75 facilities provide us feedback. And they were ranging from how do we improve our PHCs? I want to be involved in the PHC services that are being offered. I want to see my community progress. My community members need additional staffing. The facility itself is not in a good condition. Certain services are not being provided. And now when we're able to harvest or harness all of this information, we're able to break them into 3 tiers. So 1, we looked at what can the community do itself? Now, when we got into the community, we began to ask people, why don't you visit the facility? Using this model, this strengthening community engagement and accountability model for community participation, we began to ask, and then we had elderly people who say, people who go to the primary healthcare is just to give birth and to get immunization. And then we began to say, no, how do we now take this feedback to the facility? So community members who were championing this, because we're working with community-based organizations, we're working with religious leaders, we're working with leaders, female leaders and male leaders, and also youth leaders. They were beginning to say, oh no, you can come in to have body checks, you can come in to have your blood pressure checked, you can come in to have screening for diabetes, you can come in to have screening for malaria. The PHC was not only meant for just pregnant women and for immunization. Now, that prompted us to have health talks in some of these communities to say, how do we at this point take this health awareness to say the PHC is not only for childbearing, for deliveries and immunization. Now we also had somebody who walked up on the portal to say, I can't access care in this PHC because there's no way for me to enter into the PHC. And then we began to look into the PHCs to say, look, if you're going to have people come into the healthcare facility to access care, there should be a provision of a ramp, because people who have mobility issues will not be able to. There's that part of the treatment that takes away the dignity when a person comes into the system or to the facility and is unable to walk or roll themselves or move themselves into the facility and has to be carried into the facility. So a community came together and says during their community meeting, and then they went on to say, we are not waiting for government to do this. they took a portion of their facility and created a ramp. And then we began to see people who had other forms of disability come up to say, I want to be part of this initiative. My voice has to be heard, and I needed to engage. The people who share a similar situation with me. So basically, putting all of this in a nutshell for me was quite interesting, because some communities came up to say, oh no, we have security issues. We needed to think of how to secure our facilities. And they began to mobilize youths to go into that area, especially for security-prone areas, to provide support to these healthcare facilities so that the health workers themselves would be able to extend their work schedule. And when they are on duty, they do not have to be afraid. They do not have to be uncomfortable. And we began to see an increase in PHC attendance. Community members will come in occasionally on the weekend to do the sanitation exercise around the facility. They were also looking at how do we also support our facilities, minor repairs. So we were able to break them into what can the community do at the facility, what can the facility do for itself using other sources of allocations that have been given to it, what do we take up to the LGA, what do we take up to, with the ward committee channeling this, writing the course, what do we take up to the state level. And over the course of the time, we began to see certain things disintegrate, and then we began to have inclusion in the facility. PHC attendances increased, and then also some of the poor health indicators began to tilt to the green side. So for me, I think that model of community participation, which is still built on how the PHC model was structured, reviving that, ensuring that there was accountability on the part of the key health structures on the grassroots level, so the WDCs, the VDCs, the religious leaders, and having them to lend their voice and to be actively invested in participation was something that for me, it's something that is replicable, it's something that is doable, and it's something that has yielded beautiful results that can be checked, that can be proven, and that can be replicated. Thank you, and over from me.
Amazing. Thank you so much. A lot to unpack from all of this great experience that you and your team have had working with communities. And really what it sounds like is that when you talk to the communities, educate them, and actually try and get their feedback, and then use that feedback and incorporate it into the way that PHCs are run, that results can be achieved. So the question that I have for you, and maybe I'll ask Dr. Oladeinde this first, why isn't this more common? Why are we not doing more of this across the country?
Thank you, Ma. There are so many factors that create some level of gap between the healthcare provider, government agencies, and policymakers and the community. Some of them may due to previous experiences from stakeholders. Sometimes communities feel that when some stakeholders come to participate in community-related activities about their health, there is no sustainability. So there is this apathy after that such program. So ensuring continuity, and those are the gaps that the primary healthcare center, as highlighted earlier, or the health post, the primary healthcare center, the comprehensive healthcare center are supposed to fill. By definition, primary healthcare center is community oriented, unlike all other facilities, general hospitals, the teaching hospital, tertiary hospitals. So this mistrust is one of the key areas that we are looking at primary healthcare center now to address. We have the health education unit that deals with community engagement, that is looking at engaging our community, listening to them, even when it is our own government-initiated program. What is their perception? What is their concern? Which needs and misunderstanding do we need to address? And sometimes we also get the feedback from the community. while we are looking at doing this, what exactly does the community need? We have so many community with peculiar characteristics, like the Igbo community where I work is a riverine community. So they had poor access to main healthcare delivery from the upland. So we have to listen to them. Okay, how do we get vaccine here? How do we mobilize team to go to the interiors to mobilize our women? And how do we cross the waters? Sometimes these health facilities are situated at a distance. So communing from their community to such distance can be a barrier, and that highlights the need for outreaches. Okay, which communities, which centers should we locate so that healthcare workers, community health extension workers can take services closer to the people. I think these are some of the response I can give based on my field experience. Thank you.
Thank you very much. So it's clear that we have to be very intentional in communicating, engaging with the various stakeholders in the communities to ensure that they buy in to the services offered at primary healthcare centers. I guess it's not unexpected that there will be some skepticism, but continuous engagement is key. So, Dr. Davidson, let me ask you, what you've actually achieved a lot in the 5 states that you were implementing projects. So, but what would you say is the most effective strategy that you have seen from your experience where citizens have held the system accountable and secured the healthcare services that they deserve?
I think the strategy point for me that I have found to be very productive, as Dr. Oluwaseun itemized, is actually contextualizing participation. So for most of the implementers, especially for the non-governmental organizations and the CSO who are working with government itself and also government itself, sometimes we take projects to these communities, and a lot of times the need assessment is not properly conducted. Now, in as much as we are coming with different initiatives and all of that, sometimes having people sit in the room with you and then draw out the board for how this can be implemented will yield tremendous results for you that you'll be overwhelmed at how much these people know. But because they've not been included in the system, they've not been included in the planning, they've not been included in the implementation of the projects, you find out that accountability is a struggle. And then you also find out that service uptake becomes a problem too. So having the community members involved from the start itself, by participating at all the sectoral meetings that we have, by having representation, and then by also being part of the implementation phase, for me, is one of the key areas to which I have seen an active improvement in the healthcare system. I'll give you a typical example. So sometimes we're beginning to look at how do we increase human resource for health in one of the locations that we were going into. And we found out that this particular region, a lot of persons were not utilizing certain services. And so we began to ask questions, and a lady just randomly said this: my culture doesn't permit me to do XYZ. And that was just the icebreaker for me. So I came back with my team and I said, how do we convey this information? So on this point, when we were able to have this information, we had the WDC with us in the room, and we said, this is a feedback that somebody has provided to us on why she cannot utilize certain services in that particular location. And we took this feedback, we put a letter across, and we took it to the Executive Secretary of the state. He sat with us, looked at it and said, this is actually a very genuine concern that we had actually not looked in this direction for it. And then he said, okay, let's do this. And then there was some redirection to rearranging the healthcare workers in that region, and then building on it to grow a community-based approach system to also ensure that they also had retention of workforce, and boom, attendance began to skyrocket. At some point, we began to see people not only coming for that service, but coming for an affiliate service that had been linked to that primary service they were actually not going for, because they were now aware they had their voice amplified. And then there was also a documentation in part of it. The WCDC was aware. They began to also spread the news. So as they began to spread this news, we began to see that people now began to come for these services that before were actually not just were neglected. And then also other services that were adjuvant services that were linked to these services began to also experience a high attendance in terms of service delivery. So having the community participation for me and ensuring inclusivity is one model that has never failed, and it's one model that can run with the vision of strengthening the primary healthcare system.
Yeah, that's really an amazing example, because a lot of the time, let me not say government officials sit in offices, write these policies, devise these structures without really understanding the context. And there is no uniformity. There isn't necessarily uniformity across different communities. So what might be acceptable in one community is not acceptable in another. So if you do not engage with the community members directly, give them opportunities to express themselves, to, indicate what their needs are, then it is almost impossible to be successful in offering them these services. So a very good example about listening to the people whose needs you are trying to meet. Great. Thank you.
Would like to know more about the work you do, and then we'll also look at how do we leverage on what you're doing, especially with this beautiful initiative that you're actually getting people involved to raise the awareness, to raise the accountability itself, to also have active participation. So can you provide me with more insight on that?
Yes, so thank you very much. So the Aig-Imoukhuede Foundation has been collaborating with the Private Sector Health Alliance of Nigeria for some years now on the Adopt a Healthcare Facility program. And what that means is that we are officially, as a foundation, revitalizing a certain number of primary healthcare centers. And we found that it is very important to carry the community members along while we revitalize these PHCs. Because as you have very clearly illustrated in some of the examples you gave, it is one thing to have all these good intentions of all these services that you want to provide, but it's another to actually meet the needs of the people that you are trying to serve. So we as a foundation and the Private Sector Health Alliance of Nigeria are very intentional before we enter into a community to first of all engage with the traditional leaders, with the ward development committees and other key stakeholders to build trust and set expectations. As Dr. Oladeinde said, there's a lot of mistrust. People coming in, coming out of different communities, where's the sustainability and all of that. So we had a lot of meetings, lots and lots of meetings before we even started the revitalization process. Basically to get the buy-in and ownership from the community so that when the primary healthcare center was revitalized, that it would actually be fit for purpose for the community. So the co-creation process that we went through involved getting all of these different stakeholders to engage in the planning process, in prioritization of their needs, and even the monitoring of the progress made. And ultimately, because our plan has always been to hand the facility back to the community, we want to empower the community themselves to manage and sustain the PHC long after we have left. So in Edo State, our plan is to revitalize 18 primary healthcare centers, and we have done 4 so far, and we have another 9 that we are doing this year. And from the 4 that we have done so far, we did the ribbon cutting in September of last year. We have seen amazing results in terms of the attendance, in terms of births, immunizations done, health prevention, and so on and so forth. But we are not resting on our laurels, and we intend to really engage in much more community engagement and participation to ensure that traffic in these primary healthcare centers continues to rise. So it's been a journey of listening, learning, and adapting. And I think that primary healthcare centers that we are going to engage with next, the next 9, are actually going to be better than the first 4, because we have learned a lot from our initial engagement. In addition to the 18 that we are adopting in Edo State, we are adopting an additional 5 across the country. We put out a call for nominations sometime last year, and we're right now in the process of reviewing where the next 5 primary healthcare centers are going to be located. The goal of the Adopt a Healthcare Facility program is to have at least one functioning primary healthcare center in each of Nigeria's 774 local government areas. So it's a very, very big, very, very ambitious project. But I'm going to be engaging more with the Private Sector Health Alliance of Nigeria to leverage some of the learnings that I have actually got from this conversation to ensure that the community engagement, community participation is ramped up, because there's a lot of things that I'm hearing that both you, Dr. Davidson, and Dr. Oladeinde did that we could possibly incorporate into our own programs. So there's a lot of work that is needed in the primary healthcare space. We know that things are not the way they should be, but with doctors like you working in the front lines to engage communities and ensure that their needs are prioritized and met, I'm quite hopeful. So as we look ahead, what is one key message that each of you would like to leave with listeners? So whether they be policymakers, health workers, or everyday citizens, on making community participation a real driving force in primary healthcare center delivery. And I will ask this question first to Dr. Oladeinde. Thank you.
Thank you for the question, Ma. I would like to emphasize, like it was stated from the beginning, that the erroneous notion that we need more secondary health facility in terms of general hospital, teaching hospitals, and specialized health centers is not reflective of our need. We need to strengthen more our primary healthcare center across the federation. As it is today, the primary healthcare centers still serve a lot of people, and they are supposed to be the first point of contact of the individual, the family, and the community to our health service delivery in the country. So we need to embrace the health center. I would also like to reach out to the community to dialogue, to communicate, to interact more with our primary healthcare center. One of our key delivery as a primary healthcare provider is community participation, community engagement, health education, and health awareness. We are ready to talk, we are ready to dialogue, to know the needs of the community so that we can work together to prevent, to treat, and to harness our health so that the whole community is better off for it. That would be my statement.
Thank you. Thank you very much, Dr. Oladeinde. And Dr. Davidson?
Thank you very much, Mrs. Ofowe. So, but before I actually give my final thoughts, it just really occurred to me that it would be unfair on my own part to not mention that I'd worked closely with Patient on the Adopt a PHC, and we're happy
wow! So you know
yes,
about it.
Definitely. So we've actually worked with them in streamlining how we can improve the primary health care in Edo State. And then we're also test driving the same thing we have done in other states to align our engagements and then see how we can also improve, not just improve, we can build the capacity of the community itself. And then we can also look at enhancing and advocacy by making sure that the community champion the cause. So on that, I'll give my final note. The health system belongs to everyone. Everyone is a major player in the healthcare system. Your voice matters, and your contribution, irrespective of the different level of cadre, is important in the sustainability of the healthcare system. Health is a basic necessity, and then it is not supposed to be expensive. It's supposed to be accessible. It's supposed to be affordable. But in all of this we're doing, we also need to ensure that we give quality care services. Health workers in the front line who are working diligently should be comfortable, should be rewarded, and should not have to struggle when providing care. So for us to be able to achieve universal health coverage, we must take ownership. Our voices must be active. We must engage the right stakeholders using the right medium, and then we must be able to also be the accountability mechanism. So monitoring and evaluation is very important on our own part. Thank you, and that's all from me.
Amazing. Well said, Dr. Davidson. So really, our ethos at the Aig-Imoukhuede Foundation, and when we're looking at primary healthcare center, is our belief that community participation is essential to achieving lasting improvements. So our approach centers on transparency, capacity building, and partnerships that connect primary healthcare boards with technical support from the private sector and communities directly with the systems that serve them. We work with different stakeholders, as I have stated, through participatory planning, community surveys, feedback platforms, and so on and so forth. I was very, very interested to hear about the work that BudgIT was doing, Dr. Davidson, and pleased that you have engaged with Pishan on this. But I think we at the foundation need to have a deeper conversation with you to see how we can leverage some of your learnings. So to our listeners, please get involved. Don't dismiss the primary healthcare centers in your communities as not being up to standard, but then not doing anything about it. So whether you're a local leader, you're a healthcare worker, or concerned citizen, your voice matters. Support your local PHC. Share your ideas. Attend community meetings. Remember that effective community participation starts with you. And as you have heard from the conversations today, when the community participates, real results are possible. Together, we can build healthier, stronger, and more inclusive communities across Nigeria. So I'd like to say a big, big thank you to our guests, Dr. Oluwaseun Oladeinde and Dr. Biobele Davidson, for your insights, your stories, and most importantly, your dedication to improving primary healthcare. And thank you to our listeners for tuning in. Until next time, keep the conversation going, stay safe, stay engaged, and stay hopeful. Thank you very much.